You're tuned into Recovery TV, the voice of hope, with your host, John J. Tassoni Jr. Discussions and information on addiction and mental health issues. Here's your host with today's guest.
Welcome to another edition of Recovery TV, and I'm your host, John Tassoni. Narcan, please get it. It saves lives. CVS, Walgreens, URI, 400 and some odd overdoses. We don't have that many this year because of this. Get your Narcan, put it in your purse, leave it in your car, take it out at night. It saves lives. My guests today are from the biotech industry, Stephanie and Sierra, a Biomed Spa, and we're going to talk to Stephanie about what it is that they provide service for. Welcome, ladies, and thank you for joining us today.
Thank you.
Thank you for having us.
So tell us about the spa. It's not a day spa,
No.
a night spa.
No.
What kind of spa is it?
So we provide aesthetic services as well as wellness services. So aesthetic services would be Botox fillers, etc. And then the wellness services are vitamin infusions, vitamin shots, hormone optimization, and weight loss management.
On the issue of opioid use, alcoholism, how does this spa help people get healthier so they don't use?
So we don't have anything specifically to treat those conditions necessarily. However, the GLP-1s that we use for weight management have been shown to really improve addiction overall. They help with food addiction, but also anyone that has any sort of habits or cravings, if they're on these GLP-1 medications, then they have less of a tendency to do any of those habits. And I think one day that it will be used in addiction medicine.
Yeah.
It started for diabetes,
Yeah.
then weight loss, and now they're seeing what else it can be used for. So hopefully soon.
What kind of medications?
The GLP-1, so that would be like Ozempic,
Okay.
like those weight loss medications.
I'm on it.
You are?
Yep.
Yeah.
Been on it for 5 years.
We
Yeah.
take it too.
Yeah. You know, it's a medication that helps with, like I have diabetes. My father got it at 40, I have it at 40. I guess I was lucky in the gene pool to get it because I have 3 other siblings and nobody's got it. But I think you're absolutely correct in saying that someday Ozempic and some of the others will help with the cravings of substance use and medications. I'm not sure about the alcohol use yet. I think that's still under advisement. I'll use that word. But I think someday it will happen. It will happen because somebody's got to do something.
I agree.
You know, whether it's Ozempic or any of the other ones, to combat this issue that we're having. We're losing too many people, and too many people are easily steered towards the opioids and other pills that are on the street, along with alcohol. Now alcohol has surpassed the opioids in residential treatment.
Wow.
So somebody needs to figure out something over there to get that combative. So tell me about what your job is at the spa.
So I'm another injector with Steph, and I do the vitamin injections. I do fillers, Botox, PRF, all that.
What about the vitamin issue? Is that by intravenous? How does that work?
So we do like a lot of like sub-Q, intramuscular injections, and also IV as well.
Do you use Sublocade in your place?
Say that again?
Sublocade? Do you use that?
No.
That's for opioid use disorder?
We
Okay.
do, it's pretty much strictly vitamins, so we do have a few medications that we include in some of the vitamin infusions, but most of them are vitamin C, vitamin D,
Okay.
B complex. Occasionally we have some that have Toradol or Zofran if someone's feeling unwell after
Yeah.
drinking. So that can help them feel better faster, plus they get the
Yeah.
fluids and the hydration.
You know, it's amazing to me that these types of vitamins can help a whole host of different things, not just honed in on one particular disease or issue that you may have with your body. You know, when you have a system like this, and you are able to go to your spa and get an infusion, whether it's vitamin C, vitamin D, or anything else. If you're low and you need it, your doctor sends it to you. Obviously, you need a script, correct? To
It's all
take that?
prescription.
Yeah. Okay. Locations. Where are you guys located?
So we have an office in Johnston, Rhode Island, and another one in Fall River, Massachusetts.
Big clientele, small clientele, because you just started.
I think we're doing all.
You're doing
we're doing all
okay?
right, but we're always accepting new patients.
Okay. Now, does the Department of Health oversee your organization?
So they're involved, and I guess the Board of Nursing,
Okay. Yep.
because
Now, are you
I'm a
both
nurse.
nurses?
Yep, I'm a nurse practitioner. Sierra's a registered nurse. So
Okay.
the Board of Nursing, Department of Health. Yeah.
Okay. What made you come up with this?
So
Because you're an incubator size right now, right? You just started.
yeah. It's been a few. So for quite a few years, I did just the Botox and the fillers, and then it wasn't until I became a nurse practitioner that I decided I wanted to do more than that. And a great stepping stone would be to incorporate wellness into the aesthetic practice, because they do sometimes go hand in hand, because you can only look so good by injecting your face. You have to be healthy too.
Right.
So your body needs all the vitamins that it needs, your hormones need to be optimized, your weight needs to be healthy, and that's going to make you feel good and feel like you're looking your best too. So that's kind of how I
Right.
Came on.
And that's a big deal for the people that we deal with in substance use and mental health. A lot of times they don't have the capabilities of going to the doctor. Long time between doctor visits. Same thing with dental visits. You know, and a lot of people, they're not up on their vitamin C, vitamin D, or whatever, on the healthy end. I'm not sure if anybody that's in this particular issue goes for Botox, but that's another story for another day. But the vitamins are very, it's a fragile thing with these folks. Because when you don't go to the doc, you don't have blood work, and all you're doing is ingesting substances and alcohol, you're actually whittling down your body to a point where you're going to end up in a hospital where you have liver failure, kidney failure, all sorts of failures, heart issues, the whole bit.
Yeah.
But the wellness portion of that, and I'll give you just a tip, that needs to be pushed. Wellness needs to be pushed,
Yeah.
especially with people with substance use and mental health issues. Because if they don't take care of themselves, eventually something is going to happen.
Yeah.
Eventually.
Yeah.
Now, what made you get into this industry?
I was doing it before I became a nurse practitioner. I was already doing it at other locations, the aesthetic side of it. But when I finished nurse practitioner school, I felt like now I had the opportunity to do more. I was restricted before based off of where I worked.
Yeah.
So now that I work for myself, I had the opportunity to do more.
Yeah.
And I took the weight loss medication myself, so I guess that was the first stepping stone.
Oh, wow.
I lost about 50 pounds.
Wow.
And then it just took off from there. I started really getting into hormone optimization, which I love, and it's great for mental health. A lot of anxiety and mood disruptions can stem from hormone imbalances, and then the vitamins and the infusions just came along with it. Yeah.
That's interesting. That's interesting that someone who had an issue thought to get rid of that issue, and now you own a successful business. I want to talk more about that when we come back, because we have to go to break, so I can pay the bills. You're watching Recovery TV, and I'm your host, John Tassoni. We'll be right back after these messages.
Now back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, Kodak. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Biomed Spa is in the house today. Stephanie and Sierra, and we're talking about their business, spa business, help people lose weight, get healthy. It helps you with substance use and mental health issues. People need to realize that it's a whole envelope full of things that need to be antiquated into healthy bodies, not run-down bodies. What makes your spa unique?
I would say one of my favorite things about our med spa is that we take a very customized approach to each and every patient, whether they're there for aesthetics or wellness services. We never do anything that's cookie cutter. We're not afraid to say no if the treatment isn't appropriate for them. And
People ask you for different treatment?
Yeah.
And then you can say no.
Yeah, there's sometimes people coming in requesting weight loss medications and they're just not appropriate for it. There might be an underlying body dysmorphia there that's making them feel like they need to lose the weight, but they're not acceptable for the treatment. Or someone looking for more injections in their face for aesthetic purposes and they've already done enough. So there can be some situations where we definitely have to say no.
Yeah, I'm sure it puts you in a very bad spot if somebody keeps saying, oh, I want injection over here, I want injection over here, I want injection over here. And then ultimately something happens and then you're responsible for it.
Yeah, we definitely don't want to get into that situation.
What about men versus women, your clientele? Is it more men, more women?
We definitely have more women. Both of us started off with aesthetics before we brought in the wellness.
Okay.
So we have a lot more women. The men that I have in my practice are primarily on TRT, testosterone replacement therapy.
Oh, okay.
So they come for that. They come for weight loss.
Well, let me interrupt you for a
Yeah.
second. Why would they do that? Is it because of issues with their...
So testosterone levels tend to decline mid 30s to early 40s.
All right. So that's the commercial that Doug Flutie and the other guys in.
I don't know.
Take that medication if your testosterone's down.
I help them get back to how they were feeling when they were younger.
Oh, okay.
Just by giving them some
Well,
testosterone.
what does that actually do?
So
Testosterone.
your hormones do a whole heck of a lot. They help you feel good, feel energetic, feel more productive throughout the day. They can help protect you from cardiovascular disease. Some hormones can protect you from certain types of cancers or bone disease. Testosterone I also prescribe to women, so that helps with collagen in your skin. It helps with libido. It just helps with a whole number of things. You just feel really, really good when your hormones are optimized. So it's probably one of my favorite things that I've stumbled upon and gotten into.
Oh. Let me ask you another question. What is the treatment that you offer that might surprise people?
I would say testosterone for women, like I just mentioned. Men obviously know all about it pretty much, but women, I think it's less common to hear about women being on testosterone, but they need it too, along with all the other hormones that we can do, or potentially weight loss management. But I would say that's the most surprising.
So if somebody's watching the show today, what advice would you give them to move forward with your organization?
I would say definitely set up a consult if you're interested in anything TRT related, injections, filler, Botox. It all starts with a consult for sure.
So every person that comes and calls your office, you have a consultation with and set up a plan. Is that accurate?
We do a consultation and then we set up a plan based on the client.
What their needs are.
Yeah, because everyone's different, so
Yeah.
not everyone's going to kind of get the same.
Do doctors normally prescribe for your clientele for whatever, whether it's Botox or weight loss? Or
I write all the prescriptions. I do it.
you do it. So how about referrals? Can someone say that they want to go to your organization and tell their doc they need a script? I mean, I know you're a PA, but I'm just asking because people watching the show may say, "Oh, let me talk to my doc," or they don't need to. They can talk to you.
They don't need to talk to their doctor. They can just come right to me.
Okay.
Yeah.
And that's why you're the PA.
NP, but yeah.
NP? What is it? NP?
Yeah.
Nurse practitioner and
Yeah.
the boss.
Yeah.
And the boss,
And the boss.
yeah.
You do children.
No.
You have to be 18 and over?
Mhm.
Okay.
Yep.
So, what about I know you say you don't do children, but I need to get this out. There's plenty of people that watch the show. So they have a child who is getting to be obese. What's your suggestion to those parents that their child could be obese? Should you talk to your doc about doing something for these children? I mean, you see it all the time.
Yeah.
You know, no matter where you are, you know, you feel bad for some of these children are bigger than really what they're supposed to be,
Yeah.
both male and female.
Yeah, I agree. It's definitely an epidemic that we're seeing younger and younger. My son's older now, he's 19, but I remember as he was growing up seeing a lot more kids in his classrooms that were overweight than I saw when I was growing up, and it was very surprising to me, and I'm sure it's just worse now. But definitely going to the PCP, the primary care doctor, would be the first step. I don't know what they would recommend. There's a big variance in primary care doctors on what some agree with the GLP-1s, some are kind of against it. There's a lot of variance. So finding a primary care doctor that aligns with your individual needs, your viewpoints is very important, because it's tough when you have one that doesn't really see things the way you see them.
Yeah, you know, it's kind of mind-boggling too when you hear, you know, I get this, you know, when I'm talking to families about their young children and how they follow whether their mother or father on substance use, mental health, and alcoholism, about how they should talk to their primary care docs about the little ones, because most of the time it's a genetic issue.
Mm-hmm.
You know, but I want to talk a little bit more about your organization when we come back after break.
Mm-hmm.
You're watching Recovery TV, and I'm your host, John Tassoni. We'll be right back after these messages.
Now back to Recovery TV with your host, John J. Tassoni Jr. Recovery TV is made possible by our supporting sponsors and our title sponsor, Kodak. Now, here's John and today's guest.
Welcome back to Recovery TV, and I'm your host, John Tassoni. Biomed Spa is in the house. Stephanie and Shakira. I want to thank you both for joining us today.
Thank you.
Very informative. Very informative on the weight loss end, and very informative on the vitamin issue.
Mm-hmm.
Very informative. I've never had, in 5 years, had someone on with this type of experience, and I think my viewers will like it. I think you will probably get calls, because we're going to put your number and your website up there for people to take advantage, especially on the weight loss and the vitamin issue. But thank you both.
You're welcome.
So what's next for Biomed Spa?
Well, that's a loaded question, but we
That's what I'm here for.
right now it's just the two of us, and my hope is that we expand both of our offices and just bring on new providers, new practitioners that have a different set of experiences than we do, and we can just service people better and better.
So you have an office in Johnston and Fall River. What do? You split up?
We do.
Yeah.
Split up.
Yeah.
Okay.
Yep.
All right. So what are your hours in Johnston?
We work a lot. Sierra works 9 to 7. I usually work 8 to 8 for
Okay.
now.
All right.
We try to make it convenient for people that like early mornings or after work
Get away,
hours.
yeah.
Yeah.
So we work a lot.
I get it.
And weekends
Yeah.
too.
Well, thank you for both for joining us
Yeah.
today. I wish you the best.
Thank you.
On moving your business forward and getting more people. This way here we get more tax revenue in. I greatly appreciate that. Next week, my guest will be Tri-County Prevention. We'll be here, and I want to thank everyone for watching. And coming up next is Kodak Live, a fully integrated approach to care. We'll see you next week.